My name is Ariella Cohen, and I just graduated from the University of Maryland with a Bachelor of Arts degree in Linguistics. I plan to attend law school at Drexel University to specialize in healthcare law in the fall of 2012. And the only reason that I am confident that I will succeed in law school is because of the dry needling treatment that I have received from Jan Domerhalt and Michelle Finnegan at Bethesda PhysioCare, where they actually understand pain and appreciate how debilitating it can be. I have been in agonizing pain for most of my life, yet it wasn't until college that I was finally diagnosed with Ehlers-Danlos Syndrome hypermobility type. For most of my life, I had to work harder than anyone I knew to focus on my studies because of the all-encompassing pain. For my first 3 years of college, the unbelievable pain that I experienced from head to toe was only surpassed by the pain running from my mid-spine down my left leg, which was so bad that I would punch my leg, leaving bruises, in order to disperse the pain. The pain that I was in throughout college was so severe that to this day I have no idea how I actually made it through. I have always been very ambitious, but the longer I was in pain, with no relief, no useful help from my doctors, and only failed treatment attempts, the more nervous I got that I would not be able to get through school and pursue my dreams. And then, my mom and I went to the Ehlers-Danlos conference last summer where we heard a researcher from the NIH speak about trigger points in their treatment. I felt like he was speaking directly to me about my pain, and after talking with him, he led me to Jan. I started getting dry needling done in September and could immediately see that this treatment would change my life. It was unbelievable. The pain and bizarre sensations that most of my doctors had thought were neurological were actually caused by trigger points in my muscles. Doctors do not give enough credit to the amount of pain that can be caused by muscles, especially if you are living in a body that has to work so hard to hold itself together, as a person living with EDS must do. After only a few months, I could tell that my leg would feel normal again. Not only has the dry needling helped my leg pain, but it has bettered the symptoms of my GI problems, specifically severe gastroparesis, bettered my breathing, increased my ability to sit and stand for periods of time, reduced the pain in my hands from writing, and reduced my headaches and jaw pain. Before I started dry needling, I despised when doctors would ask me what my pain level was on a scale of 1 to 10, because I was in the hundreds. But now, on a relative scale, I am about a 2. It is because of the dry needling that I am confident that I will succeed in law school, and it is because of the dry needling that I do not fear that my pain will take over my life. Dry needling has changed my life. Jan's staff is warm and wonderful, which greatly relieves the stress of the medical appointments, and I cherish the relationships I have developed with them all. Going to Jan's office is always such a delightful experience, and I wish that I could be at the conference this year, as I would love to introduce Jan in person since he has truly changed my life.